Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of American College of Lifestyle Medicine. I'm both certified in internal medicine and lifestyle medicine and serve as the Chief Medical Officer of Nudge Health. Each episode delivers 5 key takeaways from leading experts, innovators, and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through practical strategies and real-world success stories, we empower you to make a lasting impact in your practice, in your organization, and beyond. In this episode, we are honored to be joined by leaders of ACLM's Men's Health Member Interest Group. Dr. Marc Paulos is a board-certified internal medicine and lifestyle medicine practitioner with over a decade of experience in sexual medicine and men's health. His practice emphasizes the connection between male sexual and cardiometabolic health using therapeutic lifestyle interventions to improve overall well-being and reduce cardiovascular risk. An active community advocate, Dr. Paulos has co-authored research on metabolic and hormonal health in men and volunteers with organizations such as Walk with Doc, US Men's Sheds, and Cycling Without Age. Dr. Kevin Billups is a urologist and men's health specialist with over 30 years of experience in sexual medicine, focusing on erectile dysfunction and testosterone deficiency as indicators of chronic conditions like diabetes, obesity, hypertension, and heart disease. He integrates traditional medical treatments with lifestyle interventions to optimize men's health outcomes. A Harvard and Johns Hopkins graduate, Dr. Billups now serves as professor of internal medicine and urology and director of men's health program at Meharry Medical College in Nashville, Tennessee. Dr. Scott Mirani is a board-certified physician specializing in physical medicine, rehabilitation, and pain medicine. He treats patients with a wide range of musculoskeletal conditions, including back pain, arthritis, sports, and occupational injuries. Dr. Mirani is a strong advocate for incorporating lifestyle medicine into the management of chronic neurological conditions and pain. Welcome, all of you. How are you guys doing today?
Good to be here.
Doing great. Glad to be here.
Wonderful. Thank you for being here. So I'm going to start with my first question, and I would like each one of you to chime in here. What led you to incorporate lifestyle medicine into your work with men's health and sexual medicine?
So I can very distinctly remember when my journey started, because it was 11 years ago when I started at Meharry, and I had reached a point in my career. I was really busy, and I had completely stressed myself out just with everything. I was a good 45, 50 pounds overweight. I had issues with blood pressure kind of going the wrong way, cholesterol going the wrong way, blood sugar. And, as a physician and as a man, I thought, I got this. I can flip the switch whenever I want and turn this around. So I'm not I'm not worried about this. Fortunately for me, a good friend of mine pulled me aside and said, you need to come to a lifestyle medicine program that I'm putting on in Chicago. And I promptly said, no, I don't have time. I'm too busy. I'm not going to do this. But for some reason, I actually did go. And when I went, it was really interesting listening to the presentations from physicians and other. It was all evidence-based. And I had to look in the mirror and just say, I'm ignoring this at my own risk. I really can't do so. I went back home and I just jumped in cold turkey. I just changed. I just said, I changed everything. But I'll be honest with you, my thought really was, I can fail this quickly and get back to my old ways, but say I tried. But I did do, and what happened was over 3 or 4 months, I dropped a good 40 pounds. My energy level went up. All those problems reversed. So I was like, this stuff works. So I started applying it to my men's health practice, which is, erectile dysfunction, low testosterone, but it's all metabolic disease. And I started watching it work in my patients. I mean, not only with on the diabetes and the metabolic stuff, but then their erections were getting better. Their testosterone levels were improving. So I became a passionate believer, and to the point now where I use it routinely. And I'm also really passionate about teaching my medical students at Meharry that you all need to learn this. It doesn't matter what specialty you're going into. This is important. So that's my personal story there.
Well, it's a great one. Scott, you're next.
Yes. What led to my interest in lifestyle medicine, specifically with men's health, is interest in my health as a man. So if I could start school all over again, if there's one specialty aside from lifestyle medicine that I would specialized in, that would have been in preventive health or preventive medicine. And I'm very interested personally in preventive medicine because, as we know, 80% of chronic illnesses are preventable.
Yes.
And I think it's a tragedy that we have so much illness, and our model right now in the United States is sick care. And my interest also in lifestyle medicine was heavily influenced by my parents. My parents followed the pillars of lifestyle medicine. They were really big into nutrition. They were very, very big into exercise, and they forced me to sleep and take naps. And I think sleep is really important, as we know. But specifically in my particular field of physical medicine and rehab, many of my patients have lifestyle medicine issues. It's estimated about 80% of rehab medicine patients are diabetic or pre-diabetic. So my involvement in men's health and in lifestyle medicine in general is very relevant to me.
Great. Marc, what would you like to add?
So I have a practice similar to Dr. Billups' practice. I do sexual medicine, andrology and sexual medicine. And I made a transition from traditional primary care to working at a multidisciplinary men's practice in 2013. And one of the main principles of bringing together medicine and urology, psychology, dietitian, as we did in our practice, was that sexual dysfunction in men, changes in sexual function are a barometer for changes in overall health. It could be cardiovascular health that's changing, metabolic health, a problem with sleep. And so men come in for evaluation for erectile dysfunction. We do cardiovascular risk assessment, and then we talk to them about managing the risks. And where they come in with low testosterone, and it's related to obesity, insulin resistance, and undiagnosed sleep disorder. So we connect that problem to something happening, the root cause, which is embedded within their overall health. Well, we don't do primary care. So I'm not prescribing statins, I'm not prescribing aspirin, I'm not doing any of those things. And so I think, well, what do I have in my toolkit? And so I can talk to patients about diet. I can talk to them about exercise. I can help them understand the connection between sleep and men's health. And so, there I went doing those things. And then over some time, I stumbled across, and I actually don't remember the moment, this organization called the American College of Lifestyle Medicine. And I remember reading and thinking, oh my goodness, this is what I do every day. Like, lifestyle medicine is a thing. And just coincidentally at that time, I had a medical student that was rotating through who was telling me about this great interest she has in this new field called lifestyle medicine. Like, okay, I said, well, look, we offer nutrition services for patients. We have a psychologist. We do sleep screens. We do nothing for physical activity. I want to do something, and I want to do a walking group, and I want to do a walk with a dog.
Wow.
So I got the student to join me to do this. I said, look, help me do this, and then you can use this for an application for Donald Peg Award, which we did the walking group, and it's like 7 years later that they're still going. Erica Bees, the student, got the Peg Award and used it to start the lifestyle medicine interest group at the medical school. And then I got involved in that, and my interest in lifestyle medicine just it took off from there. It's been rewarding. The students love it. They lack it in their education. Patients love it. They don't get it from traditional primary care. I've kind of been hooked since then.
Well, I love those stories. Obviously, some of you were inspired to bring improve your own personal health, but obviously the way you weaved in lifestyle medicine into addressing men's health is really, truly inspiring. So Kevin, I want to ask you, how can starting an open conversation about sexual health create space for men to talk more honestly about mental health, relationships, and social connection? Because we know that so many men struggle with stress-related sexual issues and really aren't sure how to improve them.
Yeah, so that's a great question, because what we know and we see all the time is that the sexual health, and I'll define that just for erectile dysfunction, low testosterone, just because that's easy for people to kind of visualize. That's a unique pain point for men. So that gets a man's interest, right? And when they come in, we also know that for many men, those two problems are related to metabolic conditions that we just mentioned, the diabetes, things like that. So we know that's going on. But we also know that virtually every man who comes in with erectile dysfunction, doesn't matter if you're diabetic, have every medical problem in the book, they're also going to have stress. They're going to have anxiety. They may have depression. They may have, with the loneliness, isolation that you talk about, and this kind of poor sense of worth. So what I found in my practice in all these years, it's easier for me to get a man with the symptom of erectile dysfunction, low testosterone, get them to understand, there's a medical reason behind this, but there are also other associated reasons with stress and the emotional issues that you talked about, because men, I think, are hesitant to bring that up. But you almost give them an umbrella of protection, I found, when you say, hey, look, this is a medical problem, but it's associated with these other conditions. But we need to address the whole thing. So I have a very low threshold for referring in to colleagues in clinical psychology, psychiatry, counseling, but to the men, letting them know that, look, we're addressing everything. Yeah. I found it takes a lot of stress off, and it makes men more open to facing some of these mental, emotional health and isolation issues. It's difficult for us to face as men sometimes.
Yeah, they're all interconnected, and I think it's just having to reassure them. So makes sense. Yeah, Marc, can you please share how we can do a better job recognizing body image struggles in men? Because something that I would think, could affect their mental health, especially if it is something that's considered more as a vanity instead of a real concern. So how should we really address that?
Sure. I think that a good point is that men experience body image concerns much the same way that women do. We tend to associate those with women and maybe eating disorders that follow and so forth. But men are vulnerable to the same things. Common concerns like hair loss or weight loss. But there are certain male-specific concerns that can be particularly devastating that sort of eat away at a sense of masculinity, and as a result can affect mood and affect how men interact and socialize. And a common example of this, and I see it in my practice a lot because I do management of testosterone quite a bit, men who come in who have been using anabolic steroids. And I think we've kind of all been there in some point where they walk in the door and they're very big and over muscular, think, oh, here we go. We're going to have a tug of war now about what we're doing with their testosterone therapy. And it's very easy to have that prejudice, coming in just based on appearance. But many of those men, and when I talk to them, one of the first things I ask them, so how did this start? Or why are you using anabolic steroids? Because in many cases, it has to do with body image. We think, oh, they're vain, or it's some kind of toxic masculinity, but they feel very insecure. People can have body image concerns. And, when they look in the mirror, they only see their flaws. And then it can become so profound that for some people, they may have no flaws, but yet they look in the mirror and all they see are flaws. And it's very painful. And people think, wow, like they're always looking in the mirror or they're at the gym and they're adoring themselves. That's not it at all. It's a painful thing that they go through, looking in the mirror and thinking, gosh, I'm not good enough. I'm not masculine enough, whatever that is. And that leads them to doing the anabolic steroids. And then it gets complicated because they develop a physical dependence on that. And they cannot get off the anabolic steroids because of this physical dependence, so I talk to those men a lot about hey, what's the root cause of this? And I think that's kind of in the spirit too of lifestyle medicine in general, like looking at the root cause for disease. They talk about that, and very often it has to do with depression. It has to do with a lack of self-esteem. When men experience body image issues, they may not want to date. They may avoid social situations, like they don't want to go in public. They don't want to change at the gym. And it has this big impact on relationships, on social connection. They develop depression, and body image issues in men are strongly associated with risk for suicide. So it can be a really important conversation to have, sort of leaving behind, and I've had to do it myself, certain prejudices, walk in the door and say, let me find out what's going on with this patient. Like, how did they get to this point? I think that's a good example of a male body image issue.
Very well said. Thank you. So, Scott, how can clinicians better recognize and treat depression in men, especially those who are living with chronic pain, when so many struggle to even sometimes even talk about their emotions?
Yes, I'm very thankful that I have this opportunity to touch upon this topic um, because of how prevalent chronic pain is. And, it's said that at least when we talk about men's health, is that chronic pain and depression have a bi-directional relationship. So if you're
Mhm.
depressed as a man because of something going on and you develop pain, it's very easy to develop chronic pain because of that underlying depression. Similarly, if you're a male and you develop pain and it develops into chronic pain, eventually that can lead to depression. So it's important to acknowledge these two things. And just for clarity, when I say chronic pain, I mean pain lasting longer than 3 months. And I'm going to
Mhm.
say, I'm sure any clinician will agree that it's much easier to deal with chronic pain than it is to deal with acute pain. Acute pain is easier. I always enjoy treating acute pain because I know I have a good prognosis. It's the chronic pain patients that are harder to treat. And, when it comes to men, it's very easy to say, oh, it's cultural and psychosocial issues that explain why men don't report pain. That is true. But there's also some data coming out that there could be a biological component and that testosterone may provide some subtle pain inhibiting effects, at least in comparison to estrogen and progesterone. So it's not always cultural, okay? There
Mm.
may be some biological reasons, and whether this is evolutionary, that's the possibility too. But in terms of diagnosis, to get a little bit into the weeds, there are three tests we use. There are the Patient Health Questionnaire 2, the Patient Health
Mhm.
Questionnaire 9 or PH9, and then there's the Beck Depression Scale. And I'm not going to go into the nitty gritty about this because these are tests that patients have to fill out. But I do want to caution that some of these tests can be confusing in chronic pain. So if a man fills out a form and it says, oh, they can't sleep or they can't concentrate, and they check that off in the form, sometimes they attribute that to the pain instead of the depression. So for me personally, one of the most valuable tools in assessing depression in men is the clinical interview. And it's
Mm.
asking them those questions about sleep and appetite and activity. But I feel personally for myself that I'm not going to ask those questions on the first interview. I have to have rapport with them. They have to
Yes.
trust me. So it usually comes out in the third interview. And I have a way of going around these questions, especially with men, because they're difficult. So
Mm.
instead of saying, how's your sleep? I might say, well, how many hours did you sleep last night? Or instead of testing for anhedonia, I might say, are you still bowling with your friends? How's that coming along? And eventually it will declare itself. The depression will declare itself if they have depression. And when I ask these questions, I will tell you, I build rapport with them because they feel I'm interested in them. They
Sure.
feel I'm actually interested in them as a human being instead of saying to them, how's your pain level today? How's your pain level? That's not the way to go.
Yeah.
So,
Mm.
as far as treatment, I'm not really going to say how we address pain in chronic pain treatment because that's a whole hour lecture. But, it's definitely incorporates a lot of lifestyle medicine. When it comes to exercise, I have to be creative with men because if they have back pain, they can't play basketball. They can't go for a run. They can't even go for a walk sometimes. So I really find ways to get them to exercise, at least when it comes to that pillar in the lifestyle medicine pillars.
Well, good. I really, really loved your answer in terms of, often we underestimate the challenges of sometimes even getting a history out of a man, right? I think they
Yeah.
may not be very forthcoming, and how you navigate that, maybe even at the third interview, perhaps you get deeper
Yeah.
into it. So, yeah, thank you for sharing that. Marc, how can we better support older men? I think something that we should definitely talk about because sometimes they are, face life events such as, having either personal illness or personal loss, sometimes retirement, and especially when this traditional ideas of masculinity could really make it hard for them to even reach out for any help. So, how do we support these older men in general?
Sure. So I think an important the point that I like to emphasize is that, and this is true across all ages, men die from suicide at higher rates than women. But as men get older, this disparity becomes striking. It starts to really diverge over 65. And by the age of 85, men have the highest suicide rate of any demographic. Older men have the highest suicide rate of any demographic in the US. It's pretty high. And so being able to recognize the antecedents of suicide in older men, as you mentioned, it could be chronic illness. It could be chronic pain. We've talked about it. It can be loss of independence that comes from physical limitations and needing to rely on others. Men go through life trying to be strong and self-reliant, and then they find themselves in a position of being dependent. It can be, loss of a loved one, bereavement, a spouse or a life partner has passed, significant risk for depression. It can be feelings of abandonment, so estrangement from kids or loss of friendships. In many ways, it can be loss of life purpose after retirement. So for people in general, but for men, their identity and their occupation become intertwined. And we are the teacher, we are the fireman, we are the doctor. And then when that role ends, it's that loss of a clear role becomes very disorienting. And all of these things can lead to suicide. So when I talk to men when I talk to them and I'm doing their history, I will ask them routine things like if they've lost a life partner, how are you feeling? This is a tough thing to go through. How are you managing? How are you navigating through this? Very often, and I ask patients this in general, but particularly in older men, I'll ask, so who's your support? Who do you go to? Do you have family that support you? Do you have kids? Do you have a best friend? Do you have a neighbor? Who's your support? And do you have those social connections? Because managing loneliness and social isolation in this particular population becomes very important. And then if I can identify that, maybe they are lacking connection, hey, maybe there are certain groups that you can interact with. Like, hey, I've got this really cool walking group, like come and walk with our walking group. Or there's this really neat organization called the U.S. Men's Sheds Association. You can find one that's local and you can join. So I really try to weave it in that way. I think helping men to understand, to normalize it, that these are normal things that people feel, that these are male-specific things that men go through. And some of this can be reassuring that it's not some personal failure, that they may lack social connection, but these are sometimes the cards that we are dealt in life. And normalizing that and then helping them to take the next step to sort of reconnect with family, friends, with some type of support.
Yeah, great. So in closing remarks, I want to ask each one of you, is there anything else that you would like to add that we haven't necessarily talked? Or are there any additional information or resources that you would like to share?
I'd like to just quickly say that unlike Marc and Kevin, who practice in a men's health clinic per se, I am in private practice, and I work with two other colleagues, and we're all physicians, and I don't practice in a multidisciplinary setting. So I have to be extremely creative in how I address the 6 pillars, and I create a system of my own of handouts, resources in the community, walking groups. I do refer to Walk with the Doc a lot. Yeah. And it addresses 2 things: their physical health as well as their social health.
Yes.
So I've created I'm in the trenches, but I create my own system, which is very different than Kevin's and Marc's practice probably.
Well, I'll say closing thoughts for me is I'm just happy to see, if you look at this field of sexual medicine, and especially the erectile dysfunction and low testosterone, which has been very, dominated by just a prescription-based approach. The idea of bringing in lifestyle medicine, and Marc and I talk about this a lot, with really transforming the whole process and offering a new option to men, because really what you want to do is, as we do in lifestyle medicine, is get at the root cause. And I can tell you firsthand, we've seen with lifestyle, you can markedly improve testosterone levels. You can, erectile dysfunction is basically a metabolic condition for the most part. So it's been exciting to me to put that out there and expose them, because men do need an option. and also kind of gear up my medical students. When I show them this, I say, and when you go out there, you challenge the other physicians about how they're treated, because this is what you're going to see. And so, you challenge them. So I'm happy to see that, and it's also been gratifying and a lot of fun to see this kind of change that we need to push a lot more. But at least we're starting it.
Mm-hmm.
Yeah, I'd build on what Kevin was saying, that my personal experience is that men love this stuff. Like they really get into the lifestyle counseling, and they are looking. Like if you look at all this like direct to consumer traffic that happens, men want the answers, and they tend to be independent, which might lead them to not go to the doctor like they should. But on the other hand, if you provide the information for them, if you fill up their toolbox, their toolkit with information about nutrition or physical activity or self-care for stress management, like they love it and they embrace it, and they go and they put it into practice, and then they come back. They want to come back and show you the results. It's a really wonderful thing. It's one of the most gratifying things. Like during COVID, when I would counsel patients and I'd have them look at movies and game changers and give them resources and share it with your wife. And they're like, Doc, when can I come back in the office? Like, I want to see you because I'm walking, I watched the movie. My wife lost 30 pounds. I lost 20 pounds. Like, we're doing it. Like, I want to come see you and show you the results. And like, there's nothing better as a provider. It's like to give somebody the skills and then watch them go get healthy and do it on their own and sort of take control of their own health. So it's very exciting. And I guess I would make that point that men, they really do take to this when it's presented in, you tailor the messaging a little bit for them. Boy, they love it. They respond to it. And I use the materials from the ACLM website all the time, the Jumpstart and starting a plant-based diet and all of those things. It's such a great resource. And it just, I would say that's the takeaway message for me. Don't count your male patients out of the lifestyle counseling. They really love it. They really respond to it.
Wonderful. Well, thank you. Thank you for your insights, Marc, Kevin, and Scott. Well, we're out of time. I really appreciate your engagement and for sharing your passion and expertise with us. It's been a true pleasure having you all join us today on the show. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring healthcare leaders and clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.